Welcome everyone. I'm Natasha Ward. I'm one of the dietitians here at Baldwin Area Medical Center, and this is Sherry Road. We're going to talk today about gut health and why it's so important to take care of our gut. One big reason is that a lot of our immune system actually resides in our gut. Experts believe that somewhere between 70 and 80%, we don't know maybe the exact amount, but we do know that our gut function really does impact our immune system. We are going to watch a video quite soon here that actually does probably a better description of this and why it's so important to take care of our gut and maybe why our gut isn't functioning as well as it used to, and that will be in 1 minute. One thing that we do know though is that if we do take that our gut health might actually impact many different health conditions. It might, if we change the gut bacteria that we have and improve it, we might actually be able to prevent allergies and potentially some chronic diseases like obesity, diabetes. There might be a connection to depression. There's a lot of different reasons that it might be important, but obviously, especially if a person has irritable bowel syndrome or other digestive disorders, this is especially important too. Just so you know, everyone right now is muted, and we will take questions at the end. So we'll be watching a video soon, and then we'll come back to Sherry and I, and we'll be talking a little bit more about gut health. So the video that we're going to watch is from NPR, and we're going to start it right about now.
The next time you look in the mirror, think about this. In many ways, you're more microbe than human. There are 10 times more cells from microorganisms, bacteria, viruses, fungi, than human cells in and on our bodies. And our genes are outnumbered 100 to 1 by microbial genes. Scientists even have a name for all these microbial genes, the human microbiome. Now, this might make a lot of people rush for the hand sanitizer. But it turns out most of these microorganisms aren't bad, germs that will make us sick. Most are good. And without these good microbes, our bodies don't seem to do as well. We don't seem to be as healthy, and we actually might get sick more often. So one question is, where do our microbiomes come from in the first place? Well, like a lot of things, it starts with our mothers. As the infant passes through the birth canal, it gets coated with microbes from the mom. These microbes may kind of seed the baby with just the right mix. Combined with bacteria in breast milk and other microbes we encounter early on, they seem to slowly take shape in our first few years of life. The overall mix of our microbes becomes very personal, sort of like a fingerprint or maybe a blood type. But our microbes tend to resemble those of our parents and siblings and may stay with us for much of our lives. They may also be doing all sorts of things, such as educating our immune cells, like this one, teaching them the difference between things they should fight off, bad bugs that might make us sick, and things that aren't a threat, like our good microbes. When we're adults, microbes become our first line of defense, fighting off germs that try to invade our bodies, protecting their turf while protecting our health. Scientists have discovered they can even spew out their own antibiotics. The types of microbes in your body vary depending on exactly where they live, like different ecosystems in nature. There are wet places like our mouths, noses, and armpits, oily places like our scalps and backs, and dry places like our forearms. Different species of microbes have adapted to each of these habitats. The biggest, most important microbial habitat seems to be in the gut. It's the most complex, the most diverse, and everything microbes are doing everywhere else in our bodies, fighting off infections, revving up and dampening down our immune systems, signaling cells, that's all happening in the gut in spades. They even seem to help regulate our metabolisms, how much energy we burn and how much fat we store. So if it's not functioning properly for some reason, because of what we eat, antibiotics we take, That may actually lead to all kinds of diseases. Diseases like colon cancer, colitis, maybe even diabetes and obesity. Some scientists think one reason a lot of diseases are increasing is because we've lost key gut microbes. Our microbiomes look far less diverse compared to those of people in less developed countries and earlier generations. And remember how we get our microbiomes in the first place? From our mothers when we're born and from breast milk? Well, some scientists think that too many babies aren't getting that because of all the C-sections and not enough breastfeeding, plus all the antibiotics kids get these days and our obsession with cleanliness. All this may help explain why problems like asthma and allergies have been soaring. Maybe because our microbiomes never taught our immune systems how to work the right way. Maybe swallowing good microbes, probiotics, could prevent and treat some diseases. So could taking prebiotics, essentially food that good microbes love. We end our story with a reminder. This research is really new. We still have a lot to learn about what many of our microbes are really doing. But scientists say that it's getting clearer and clearer that the tiny organisms all over our bodies are essential to our health and happiness.
All right, that was a great video kind of explaining the importance of our gut health. And so today, Tasha and I are going to look more at the probiotics, the prebiotics, some supplements, some other supplements that we can take, and then talk a little bit about leaky gut. There's lots of places that we can discuss, and it's a pretty big topic to try to cover in this little short time. But we're going to start off right now, and I'm going to talk a little bit about the prebiotics and the probiotics that we can get from our food. Being dietitians, both of us would agree that if we can steer people towards food, that's the direction that we will send them. We did send you a list that had some foods that are considered good prebiotics and some foods that are considered good probiotics. And so at first I'm going to talk a little bit about the prebiotics. The reason that they are so important is that they actually feed the probiotics. It's the non-digestible substances in those foods. And if we can, we should try to get our prebiotics and our probiotics together. And so what kind of happens is that the prebiotics that we eat will release fatty acids, which will then decrease the pH balance that's in our colon, which then can help us increase our mineral absorption, calcium, iron, magnesium, which then can maybe help lead to decreased osteoporosis. The decrease in the pH in our colon can also help maybe decrease the survival of some pathogenic bacteria that might be in there. It can help decrease our cholesterol levels. It may help decrease colon cancer, and it may help with some constipation depending on which prebiotics you are using. So fiber, we talked the last time about fiber, and again we're gonna talk again. Fiber is really important, especially soluble fiber in our prebiotics. So oats, legumes, chicory root, Jerusalem artichokes, wheat, barley, rye, flax, asparagus, leafy greens, and then berries and bananas and honey. Garlic, leeks, and onions are also all good sources of prebiotics. If we can incorporate them into our diet, they can help feed that probiotics or the good bacteria that's in our gut. So probiotics, the definition of them is a live microorganism when ingested in adequate amounts confer a beneficial effect. And they, of course, don't know the exact number, but they're guessing that we have like 100 trillion bacteria in our gut. And so like the video said, and like Tasha said, anywhere from 60 to 80% of our immune cells are in our gut, so very important. And the video reinforced that, what is affecting that gut health, the C-sections, breastfed or not breastfed, antibiotic usage, the food sources, the fiber that we're eating, actually our age also plays a big role. So the 4 best food sources of probiotics that we can get, and these may contain trillions of probiotics when we consume them. The first one is kefir, which is like a fermented cow's milk, or think of a yogurt that's in a liquid form. Kimchi, which is a fermented spicy pickled cabbage. Kombucha, is that how you say it? Kombucha? Okay, it's a sweet tea that actually has cultures of yeast and bacteria in them. And if you kind of go out and Google recipes for this, there's lots of recipes for it, and you can get a little starter kit to kind of get yourself started. And then fresh sauerkraut, not the canned, it's not pasteurized. And when you think about sauerkraut, it's salt in it, and it's cabbage, and it's left to ferment for a long time in order to be good and healthy for us. So others that may have some probiotics in them, but they may not be fermented enough, of course, is yogurt. And you want to look for live and active cultures. Tempeh. Miso is a fermented soy paste that's made into a Japanese soup. But the first 4 that we talked about for sure are the most important for getting those good probiotics if you can incorporate them into your diet. If you don't like these, then Tasha's going to talk a little bit about probiotic supplements that we could take.
Right, so as Jerry said, food is always really our first source. That's really what we want to go to first. And a good example of why that's so important is that those first 4 foods that Sherry mentioned can contain up to trillions of probiotics, or of bacteria that are probiotics. So if you take a supplement, you're never going to quite get that amount. So it's really important that we say, if you can get it from the food, you will be far better off. How much do you have to eat? That's always going to be the question. Obviously, if you could eat 1 serving of one of those foods every day, that'd be great. If it's a couple times a week, that still helps. But if that either won't work, you can't do that, or maybe you're fighting a pretty significant, issue related to your gut health. So maybe you're having some significant diarrhea. Maybe you're taking antibiotics right now, and you know that you really need to work on your gut health. Maybe you're experiencing some diarrhea because of it. Then a supplement might be a good route to go. And there are a lot of different supplements, which is where it gets really confusing and challenging. And they're also not regulated by the FDA. So it's always a little bit trickier to know which ones are right. So we have some tips for you on kind of what to look for in a probiotic. Some things to think about. Sometimes the amount of bacteria that they'll have in them will only be 1 to 2 billion. And on the back, you'll see it as CFU, 1 to 2 billion CFU. You really want to look for about 5 for sure or more. That's what's been studied and has been shown to be at least a little bit more effective, especially with helping with diarrhea. But really going a little higher would be better. So up to 15 billion or even 30 to 50 you'll sometimes see. And of course, those tend to be a little bit more expensive. But depending on what you're dealing with, that might be a better option anyway to get to a higher dosage of the amount of bacteria. The best options also have multiple strains of bacteria. You don't want one that just has one kind of bacteria. Although we do know that each of the strains might actually work on different things, but that research is still coming, so we don't have all that information yet. That's why we like to say to try to find one with multiple strains. And on the back, it will also say what those strains are. So we want to look for strains from Lactobacillus, Bifidobacteria, Acidophilus, Saccharomyces, which is actually a yeast. The Saccharomyces and the Lactobacillus rhamnosus actually do have multiple studies on them related to antibiotic-related diarrhea. So those are the type you might want to look for in particular if you're taking antibiotics or if you've been taking a lot of antibiotics or your child has. That might be something to consider. Some of the brands that contain those are Florastar, and Culturelle are two of them that do have those types of bacteria. There are many other brands that we have. I do tend to think some of the more expensive ones tend to maybe be the better options. Nutridyne or Metagenics, VSL number 3 is another one we like. But our local pharmacy does have PB8, which is reasonable as well.
And gluten and dairy free.
Yes, and that's something to consider too, because some of the probiotics will not be dairy free or gluten free, so you'll want to look at that too if that's a consideration for you. One thing too to keep in mind is you want to change up your probiotic every now and then, and you don't necessarily need to take it all the time. If you are dealing with some significant illness, or you maybe are suspected of having a leaky gut, you're having a lot of gut-related issues, you probably need to take it for a while. But there might be a point when you'll be able to stop it for a period of time, and then you might want to restart it in about restart another one in about 60 days. You want to constantly be bringing in different bacteria. So that's something to keep in mind too. Once again, the food would be ideal. So maybe when you finish your antibiotic, that doesn't mean you stop your probiotic, keep doing it for a while, but you also could start introducing some of those foods that are high in probiotic, and then you might be able to stop the supplement for a while as well. So there's a lot of different considerations, but that can definitely help to start taking a probiotic. That's also the case if you have a child who has a lot of ear infections, or if you're someone who has a lot of bladder infections, a lot of antibiotic use, you definitely will want to start a probiotic. All right, Sherry is going to tell us about a few other supplements and other nutrients that might also help with our gut health.
So if you would see a functional provider and they were going to start working with you on some gut health, a few supplements that they may recommend for you. The first one may be L-glutamine supplement, which is just an amino acid, but that can help repair the gut lining, especially if you have been having a lot of diarrhea. Some other supplements that they might prescribe is zinc, omega-3s, the fish oil tablets, looking for a good quantity of EPA and DHA to be at around 1,000 milligrams. And then perhaps sometimes some digestive enzymes, hydrochloric acid, bile acids, depending on how that gut is working. So when we're looking for a good fish oil tablet, I always like to say that the food industry and when they're making the fish oil tablets, it's a lot cheaper to put in the omega-6s, the vegetable oils, and it's also a lot cheaper to use the plant-based, but it's really the fat from the fishes that has been proven to be anti-inflammatory, and so that's what we want to look at. So when you're reading your label, the two of them together should equal about 1,000 milligrams. And we don't care if there is some omega-6s or there's other oils added to that. We just want to make sure that if you're taking that fish oil tablet to help with your gut issues or inflammation or whatever you're taking it for, that you're getting a good quality. We want to store it in a cool place. My provider told me once, if you have fishy burps, that if you store it in the freezer, that you won't have that anymore, and she was right, because it went away. So keeping them in the freezer or keeping them in the refrigerator can be beneficial as well. So otherwise, when you see a functional medicine doctor, they first probably will put you on the probiotics, and they will ask the questions. They will ask you if you were breastfed. They will ask you if you've been on a lot of antibiotics. And so kind of depending on what your answers are to those questions, then that probiotic would be important. So be it from the food or from the supplements that Tasha was talking about. A couple things on those probiotic supplements too is that you want to keep them in the refrigerator as well as the fish oil tablets, because probiotics are anaerobic. So if you're going to take them with a cool food or a drink. The same with the omega-3s, because it would be nothing worse than have melted fish oil in your mouth. And you might have some bloating, you might have some constipation or some bloating or some diarrhea or some uncomfortableness when you start doing probiotics. So if you're taking a supplement, maybe taking it in the evening also might help a little bit, so you're not having to deal with that at work. So.
And typically that will get better within, I mean, some people don't even have those symptoms,
Right.
but typically it gets better within a couple of weeks.
Mm-hmm.
I've had a few rare cases where it takes a month or two,
Right.
But most of the time, most people will say that their gut seems to be functioning a lot better. They're having a lot less digestive related issues, which are probably attributed partly to those probiotics and hopefully also from eating a healthier diet. And that kind of leads us to some other things that we can do with gut health. Food sensitivities and food allergies can be another huge component with gut health and gut issues, sometimes related to not having all those good bacteria. So then we have to figure out why their body is becoming inflamed and reacting basically to having certain foods. So another thing that we do sometimes recommend is doing what's called an elimination diet. And that's something that we typically like to see someone for, where we might eliminate certain food groups, typically dairy, gluten, soy, corn. There's a few others as well that we would probably consider. And we try to take them all those foods out, and then we'll add them back in eventually after about 3 weeks usually, and add them back in one at a time and kind of challenge them. And see if actually the person reacts to it or if they feel okay. And then we kind of continue from there, and through that process are able to figure out if there are certain foods that a person should avoid for a period of time or potentially long term too, because their body seems to react to it. And sometimes they'll have gut related issues as some of their symptoms, and there's other symptoms too, like hives and rash and
joint achiness,
joint pain, lots of different migraines, lots of different types of symptoms that might also be related to those foods, but gut and digestive related issues can often be part of that as well. So that's another consideration and something that we would typically do, but this is really just a small snippet. Gut health is huge. It really covers it's a very broad topic. We could talk about this probably for a long time, and for everybody it can be a little bit more individual. So this is kind of just the beginning, just a snippet.
So besides the list of the probiotics and the prebiotics, we also sent you an evaluation that we might do when a patient comes in and they're having some gut issues, and you will just fill this evaluation out and see where you score in regards to inflammation and where you score in regards to digestion. So if it's 3 or higher that you've checked off, then likely maybe an elimination diet might be something that would be beneficial for you. However, they have some towards the bottom of the evaluation that have asterisks by them, and usually they say if you select those, then probably an elimination diet would be for sure beneficial for you. So Tasha and I are available to be seen as outpatients. You just need to get a referral from your provider. Otherwise, every other month, if your insurance doesn't cover it, we do have a community nutrition class that meets on the second Monday of every month from 4:30 to 5:30. And so you could sign up for that. One month it's gut health, the next month it's heart health. We flip back and forth, but if we don't have people signed up for heart health and everybody's interested in gut health, we can just flip them as we need to. So
registration is recommended for that as well. Please pre-register online, or you can actually call Sherry's number at
715-684-3311. That's the main number, and just ask for extension 194. So,
okay.
All right, we're going to open up your, we're going to unmute you.
Open up the lines for
Open up the lines,
questions.
I guess, and if you have some questions, we can try to answer them.
There we go. Like an apple big.
Yep.
Whatever.
That would be still be good.
Yeah.
So keep in mind, right now you are unmuted. But if you have any questions, we would love to answer those. You can also message as well. If you'd like to type your message, Maggie will let us know what the questions are.
Poor Randy.
His microphone is more fun.
It's probably down here.
Okay, it sounds like maybe we don't have any questions right now. If you do, you can always contact us here at the hospital or by email. Oh wait, we maybe do have a question?
What about celiacs and tolerance?
Okay, so the question was, about celiac disease and testing for celiac disease, which is a great question. So celiac disease is actually on the rise. It's a disease where a person cannot consume gluten at all. Gluten is a protein that's found in wheat, barley, and rye. There's a lot of people though also who are very potentially sensitive or have intolerances to gluten too, and that's kind of a separate piece. And I think there's a lot of different reasons why that could be that we haven't quite figured out. But celiac disease, if a person eats gluten, they actually are damaging the villi in their small intestine. So it's very serious, and there can be a lot of nutrient deficiencies from that as well. So it's really important that that person goes completely 100% gluten-free. So there is testing that can be done for that, a lab test. And what you would do is you would just ask your provider. Obviously, if you've had a history, there's really a lot of symptoms that can be related to celiac disease, a lot of gut-related symptoms, frequent constipation, long history of diarrhea, so frequent bowel movements, rashes, I can't even think of all of them. There's so many joint issues.
Failure to thrive in children.
Yes, failure to thrive in children. So that means really kind of stunted growth and poor weight gain, poor appetite, a lot of nausea, vomiting. I feel like we're probably missing some. There's really kind of a long list of potential symptoms that people will have. And once they eat a gluten-free diet, their gut will heal and recover, and they will usually not have those symptoms at all. So there is a test that can be done. You do actually have to be eating gluten before the test in order to have a positive test, a diagnosis. They also can biopsy in the small intestine and test that way as well. So there are a couple different options for that. Sometimes the test will come back negative, but a person will say, every time I eat gluten, I get sick, or I have these symptoms. And that's kind of related to those food sensitivities we were just talking about, where we might do an elimination diet. Sometimes we do an elimination diet with just one or two different foods, and gluten might be one of them. So typically we would say, it's definitely a good thing to talk to your medical provider, see if you can have the labs done for that. And if they come back positive, then you have to be 100% gluten-free really all the time, or you could potentially be doing damage to your gut. But if they come back negative, though you still feel like you have some maybe intolerance to gluten, then I would still recommend eliminating it and see how you do. That's the one great thing about food, is at least we can kind of experiment a little bit and see what works best for us and what we tolerate.
How long does it typically take for gluten to get out of your system?
Okay, how long does it typically take for gluten to get out of your system? Well, most digestion within a couple of days really will be gone. Now, if you're referring to how long should you really follow a gluten-free diet to see if it's helping you, we usually recommend a minimum of 2 to 3 weeks, a minimum. Some providers will certainly say you need to do it for a few months to really see the full benefit. So it might depend on your symptoms and what's going on, but I would definitely say 3 weeks is the absolute minimum, and then potentially longer depending on what type of symptoms you're trying to observe improvement in. Okay, it sounds like we might have answered all of the questions, so I think we're going to sign off. Thank you very much for attending today. We'll have another virtual class in 2 weeks, and I'm in the
exercise.
And it's exercise, which will be really fun too. So this will also be I think this clip will be sent out as well. And let us know if you have any questions later. Thank you.
Thank you.